Personalized medicine is the next frontier in medicine.
My name is Karen, and I have had a thyroid nodule since 2007, and we wanted to get it re-biopsied.
The typical example is a patient who has had a biopsy elsewhere, it's been inconclusive, and they say, well, you need to go to surgery to find out what you have, whether you have a cancer or not.
Surgery was one of the options.
So our personalized approach is to say, is there something we can do before surgery to tell if it's cancer or not?
And doing this genetic testing was another option.
Now, over only the course of a year, we can do one of these diagnostic molecular personalized tests to try to find out if in fact this nodule is benign. And the strength of what we're doing with our test is its real strength is in the fact that if it's benign, we're very confident that it is a benign nodule and we don't need to send that patient to surgery.
When I got the results, I was actually in the office. So when he called and told me that it was negative, that it was benign, I think I had questions for him, but all I knew was what he told me, and that was it. I wanted to hang up because I wanted to call my husband and tell him that everything was okay.
When I do this in person, actually, this is some of the most hugs that I as an endocrinologist get from patients when they're very excited about not having to go through a surgical procedure and knowing that their nodule is benign.
Personalized medicine has been a dream of people since the completion of the Human Genome Project in 2003. So the School of Medicine will build this new division over the next 2 or 3 years, which will benefit all of us, researchers, clinicians, patients.
It's just the way I want to be treated. I'm David Schwartz. I'm the chairman of medicine. I'm a professor of medicine and immunology. Each one of us are different. And in point of fact, each disease that we treat has a spectrum of activity. And I think that personalized medicine will allow me to treat my patients as I want to be treated.
The type of work we're doing in thyroid right now with nodules and diagnosis of cancer, the general concept can be applied in many areas, and it is. For example, some of our own researchers here are doing work on looking at patients with pancreatic masses and to say, is it pancreatic cancer or benign? That's a much bigger surgery to find out if it's cancer or benign.
But it'll allow us to do quality improvement. It'll allow us to identify patient populations that are particularly vulnerable. It'll allow us to discover new genetic causes of disease or new gene and environment interactions. It's the conceptual and scientific and intellectual commitment to move science and medicine forward in the most advanced way to benefit our patients.
For each patient that comes into my office, when I can tell them you don't need surgery, this is benign, is a thrill for them, but it's also a thrill for me.
Personalized medicine is the next frontier in medicine.